Most doctors end up in one of a dozen well-known specialties, but medicine is a much wider field than that. There are physicians operating on patients before they're even born, doctors who exclusively treat astronauts, specialists whose opinions can send someone to prison or set them free. Most medical students have no idea these careers exist. Here are 12 niche doctor specialties you've probably never heard of. Dr. Jubal, MedSchoolInsiders.com. Fetal surgeons operate on patients who haven't been born yet. Working with fetuses still in the womb, they correct congenital anomalies like spina bifida before birth with the goal of preventing lifelong disability. It requires training in both maternal fetal medicine and surgery, and there are only a handful of fetal surgery centers nationwide. Aerospace Medicine physicians keep pilots, aircrew, and astronauts medically fit for conditions the human body wasn't designed to handle. That means managing the physiological effects of high altitude, G-forces, radiation exposure, and the demands of long-duration spaceflight. As commercial space travel expands, the specialty is becoming more relevant than it's ever been. From the upper atmosphere to the ocean floor, undersea and hyperbaric medicine physicians manage the medical consequences of high-pressure environments. That includes decompression sickness in scuba divers, carbon monoxide poisoning, and non-healing wounds, all treated using pressurized oxygen in hyperbaric chambers. It's a small specialty with a narrow focus, but the conditions it treats have almost no other good treatment options. Forensic psychiatrists work at the intersection of mental health and the legal system, evaluating defendants for competency to stand trial, assessing risk of violence, and providing psychiatric care to incarcerated individuals. Their clinical opinions can determine whether someone goes to prison or a psychiatric facility. In most of medicine, a doctor's judgment shapes treatment. In forensic psychiatry, it can shape the verdict. A single evaluation can determine whether someone is tried, convicted, or committed, making this one of the few specialties where clinical opinion carries direct legal weight. Wilderness medicine physicians specialize in emergency care where the nearest hospital might be days away. They manage everything from altitude sickness to snake bites to avalanche injuries and hypothermia, often with limited equipment and no backup. It's one of the few specialties where the environment itself is as much of a variable as the patient. Behavioral neurologists treat conditions at the boundary of neurology and psychiatry, including dementia, traumatic brain injury, and neurodevelopmental disorders. They're often called when a patient's personality or cognition changes in ways that don't fit neatly into a single diagnosis. It's a specialty that deals directly with questions of identity, memory, and how brain disease reshapes who a person is. Medical geneticists diagnose and manage hereditary conditions, using genomic data to guide treatment and counsel patients on inherited disease risk. As whole genome sequencing becomes cheaper and more accessible, the specialty is moving from rare disease management to mainstream medicine. Within a generation, a medical geneticist's input may be standard in the workup of cancer, cardiovascular disease, and beyond. By the way, if you want the complete picture of every doctor career option you can choose from, we put together a full specialty list of over 140 paths, linked in the description. Transfusion medicine physicians oversee blood banking and transfusion services, managing the safe collection, testing, storage, and administration of blood products across an entire hospital system. They're rarely in the room when a transfusion happens, but every unit of blood a patient receives has passed through their oversight. It's one of the most essential behind-the-scenes roles in medicine. Correctional medicine physicians provide healthcare inside prisons and jails, managing chronic disease, mental health conditions, and acute illness for one of the most medically underserved populations in the country. Incarcerated individuals have disproportionately high rates of HIV, hepatitis C, tuberculosis, and serious mental illness. The clinical complexity rivals any hospital setting. The difference is that almost no one talks about it. Integrative medicine physicians combine conventional medical treatment with evidence-informed complementary approaches, including nutrition, acupuncture, and mind-body therapies. The distinction from alternative medicine matters, as this isn't a rejection of conventional science. It's an attempt to expand the clinical toolkit within a rigorous framework. The field continues to grow as research catches up to patient demand for whole person care. Physicians can pursue formal certification through the American Board of Physician Specialties. Migraines and cluster headaches are among the most disabling conditions in medicine, and they're routinely undertreated, which is why this specialty exists. These physicians manage complex medication regimens and perform procedures like nerve blocks for patients who have often spent years being undertreated. It's a field built around conditions that are routinely dismissed despite being among the most prevalent causes of disability worldwide. Culinary medicine trains physicians to use food and cooking as clinical tools. counseling patients on nutrition in practical, hands-on ways rather than handing them a generic pamphlet. Some programs even teach doctors to cook alongside their patients. It's a field sitting at the intersection of medicine, public health, and nutrition science. Most of these specialties are small and highly selective. So the more practical question is, which doctor careers will be in the highest demand as AI reshapes medicine? That answer might surprise you even more. Find out in this video right up here.